My talent in this life is talking. I can give you comfort and make you happy in 10 minutes.
Okay.
My name is Khanyisa Booi. I am a campaigns manager as well as health communicator. I am from Umtata, in the Eastern Cape, second born of four, 3 girls. Growing up in Umtata, you never really know from a place like Kwapain that you are poor. Like, you grow up thinking, highway to Sonke Siyalingana. You know, if I don't have, I go to the neighbors and I get. There's no issues of sanitation because you've got long drop toilets. If you want water, you go down to the river to get water. But I think my move to a multiracial school kind of showed me what was happening in my life. I didn't know that I was considered poor. Then I went to a multiracial school and I realized, hey, well, other children have flushing toilets that I see on TV. Other children have multiple clothes. And I have to say that my family wasn't necessarily without, but it is now coming and being confronted with how much a difference it makes for you to think you're fine and to move into a place where people have more than enough. My dad wanted me to be a computer scientist. So after matric, I pursued computer science for 2 years. I couldn't. It was just not happening for me. Like those JavaScripts and staring into a computer for a really long time just wasn't working for me. A lot of property groups do corporate social investment, and so that was my initial entry into community work. So we started an NGO while I was living in Durban that kind of fostered that sense of community, where we started community gardens. You would think that gardening and sexual and reproductive health are miles apart, but in actual fact, they're very closely linked. So if you think about the issues that we're having, where we've got child-headed households that are headed by the elderly, and real issues where younger girls are being picked up by older men and they are being given money. So that intergenerational relationship that's very transactional. And so you find that in that space, there's a lot of HIV infections, there's a lot of teenage pregnancy, there's a lot of gender-based violence. And so you realize that all of these things, there's like a really big intersection there between a real hunger, where a person needs bread, that transaction or that interaction really does put food on their table. And then the consequence, or subsequently, then that transaction can then lead to a pregnancy, can lead to an infection, can also be an abusive relationship. And so for me, it was realizing that there are vulnerabilities, real vulnerabilities for women, for girls, for also queer persons who are in transactional relationships. In this kind of transition between realizing what community eating, community sharing was, I realized there's a lot of other stuff that's going on. And so I really started etching into sexual and reproductive health, thinking about what it means for a child or learner who's in school to access contraceptives, to understand the differences that are happening in her body. And fortunately for me, I became part of the Activate Change Drivers program, who I later worked for, to kind of do bigger things with the things that I was thinking. I contributed together with different communities and a network Activate to the National Youth Policy that was being being reviewed. We really thought it was important for people to look at the youth policy, where it's like, look, there's all these things that are written about us. This is what they're saying about education. This is what they're saying about health. Look at how our statistics are when it comes to HIV. So I've worked with a number of NGOs doing the sexual and reproductive health. We've really been figuring out what does it mean to communicate health-seeking behavior, being able to understand one's body, different tools to be able to get young people in general really, to be more aware of themselves and actually seek out pleasure, and if there is an issue, to run in and get the help that they need. So I worked with IPA South Africa, worked with Activate Change Drivers, at some point with IBIS, with different NGOs that are doing this work, some with the research, some within community. And I was excited to put together a book, an information book that really is fresh to the eye, that gives you simple, easy to consume information about sexual and reproductive health, and the eventuality sometimes that is abortion. I'm really, really excited to be able to drop the initial one on the 31st of August, to be shared with NGOs and everybody at large.